Today, I'd like to share a clinical case about clinical experience in treating left medial lower limb abductor muscle injury pain with abdominal diagnosis acupuncture. Mr. Liu, a 52-year-old recreational athlete with a media building, was referred to my clinic by a friend. He presented with a depressed expression. 3 years earlier, he had sustained an injury to his left calf while exercising. Since then, he had experienced progressive lesion pain throughout the left lower limb, describing the sensation as though a tight tendons were continuously pulling on his legs. Over the course of 3 years, he sought treatment from both Western medicine and traditional Chinese medicine practitioners, and underwent extensive medical investigations, all without satisfactory improvement. Following my professor's abdominal diagnosis acupuncture protocol, I first performed a systematic abdominal examination. All 4 major abdominal diagnostics findings were clearly positive. Palpation of the left inguinal ligament region elicited severe tenderness, causing the patient to cry out in pain. Marked hypertonicity ++++ of the left thigh abductor muscles was also noted. The patient then informed me that he had previously been diagnosed with an adductor muscle injury. It was one of those moments that reminded me how patients with long-standing conditions often gain a deep understanding of their own bodies. Hearing this further strengthened my confidence in the abdominal findings. Acupuncture treatment was administered using the following prescription: right Naguin PC6, left Gongsun SP4, bilateral Liklu 7, Jaoxin K18. The metal water treatment of the spleen meridian, left Hongfeng LR4, Chizlu 5, right immune point, and finally the bilateral stomach keyline. The treatment proceeded smoothly according to protocol. Immediately after treatment, abdominal reassessment demonstrated a marked reduction in all 4 abdominal findings. Only minimal tenderness remained over the left inguinal ligament region. The needles were retained for 35 minutes. Upon needle removal, the patient reported significant improvement in his left lower limb pain. He also mentioned that discomfort around his left ankle, which he had not previously reported, had completely resolved the following needling of LR4 Hongfeng and SP5 Shankyu. The smile that returned to his face reflected the relief he experienced. A 1-week course of Chinese herbal medicine was prescribed as adjunctive therapy. At the 1-week follow-up, the patient reported substantial improvement in the pain affecting the left hip adductor muscles, with only mild residual discomfort remaining in the posterior calf. Repeated abdominal examination revealed that the previously positive abdominal findings had essentially resolved. A second acupuncture session was performed using the same treatment strategy. In view of the remaining posterior calf pain, metal water treatment of the bladder meridian together with treatment of the myofascial knots in the BL57 Changshan region was added. The patient was advised to return 1 week later for further follow-up. Studying abdominal diagnosis acupuncture under my teacher has greatly enhanced my confidence in clinical practice. Time and again, I have witnessed its remarkable clinical effectiveness, and have come to appreciate the crucial importance of resolving the 4 major abdominal findings. My professor's teachings continue to guide my daily clinical work,